52% of employees in the US get their health insurance through employers. And what we do as employers to take our voice up to the next level, so we influence policy, we influence what the market does, that's where we need to go. And I think what you'll hear today as we go on this journey is you'll hear from a lot of the different stakeholders.
I once heard a hospital CFO say, you got to understand, Mike, the challenge we're facing is we're trying to disassemble the plane and reassemble the plane. It's conversion from fee-for-service to fee-for-value while we're flying it at 30,000 feet.
Employers Health is an independent group purchasing collective for pharmacy benefits. So as we're advocating for our employer and plan sponsor clients to give them better outcomes and better financials and better contracting, it's really important for us to hear directly from them on the challenges we're facing so we can advocate with the PBMs on their behalf.
So here in the Philadelphia area, the idea of healthcare is something that takes a lot of different organizations to come together and collaborate. So when the Greater Philly Business Coalition on Health can have events that brings together clients from the area, other healthcare stakeholders like vendor partners, like health plan partners, community organizations, it makes a really great experience to bring all of those different perspectives together in the same room so that we can share with each other, we can learn from each other's experiences, and really be able to bring those back to all of our individual organizations and bring all of those different perspectives back to help the access of healthcare across the Philadelphia region.
That we had a responsibility to expand our programming, the work that we did as benefits managers, to not just be transactional, but to be advisory. So we really think of ourselves now as like benefits consultants, helping our employees to not only understand the coverage that they have, how to do it cost effectively, but also to take advantage of what we have, and that includes the original wellness programming that we did.
We always say too, it's kind of like a reunion every year when we get back to meet colleagues once again at this annual event. It's just a testament to the job that's done here by the coalition, that so many vendors come back year after year, and that's really why we enjoy it at United Concordia and why we get so much fulfillment out of being here every year.
It's an opportunity to meet local people in our field, to kind of like make the connections here and just kind of tell our story, to make sure that while everyone, especially in the Philadelphia area, is kind of grappling with these rising costs of healthcare, that we're getting that message out to them, and we're kind of in a kind of a more intimate setting without it feeling like a sales pitch, that we're kind of discussing like, hey, we think there's some demonstrable ways to help you. Being able to just kind of have those one-on-one conversations is always, to me, the best reason to come to all these events.
The people that show up here, they actually want real solutions, and they're willing to work. And so the brokers, the providers, the point solutions, everyone that's here, they're actually all morally aligned to giving a better solution for these plans. We spend so much time going to events where that's not oftentimes the case. And so if you think about just the return on investment from a time perspective, you can go here and everyone's already trying to find real solutions to real problems, versus the other events you may go to where you have to scan the room for so long to figure out what groups to speak with to actually go through and start having fruitful discussions to actually be like a real solution provider.